Hey, I'm Dr. Rayapudi. I'm from Gastro Office. So, constipation is a huge issue. The one thing I noticed that a lot of people don't realize, or patients, is constipation can cause a lot of other problems. What do you mean by other? I think everyone's aware that constipation means difficulty passing stools. So, but the problem is once you don't pass the stools regularly, you have other issues that can happen from it, which is bloating in the belly. A lot of times, patients come to us with bloating, and the bloating can be the result of not passing stools regularly. Because if you can imagine, the colon is like a big tube inside, which is holding your stool. So if you're not emptying it out properly, it can occupy a lot of space inside the belly, and so you tend to get a lot of bloating. That's one thing. So the second thing is you could have excess gas from the bottom, which is called flatus. So sometimes you keep farting more, which could be that you're not passing the stool out properly. I mean, which is a byproduct of the constipation too, because your air needs to come out. So then the other times patients get severe acid reflux. That's been worsening because it's also a space issue. If your colon is full and your belly is fully occupied with your colon, then you're mushing on the other bowels, causing bloating, and also on the stomach, thereby causing your acid to flare up because your stomach is not emptying out on time. Then you tend to get more acid reflux. So you can also have lower belly pain. I get a lot of the more common in females, I would say, the lower belly pain on both left side and right side. They get these weird nagging pains, and usually once we treat them for constipation, it tends to get a lot better. But it requires, sometimes they go to multiple doctors, they're gynecologists, they're primary care, and then they ultimately come to us, we're gastroenterologists. So I'm saying constipation can cause various issues and may just be in most people's mind the inability to pass stool, but no, that is causing a lot of other issues. So something to keep in mind. And the other thing I hear often is that patients have nausea. Nausea can come from, I mean, obviously there are other causes of nausea, but one of the other reasons I notice in my clinic is inability to pass stool, and then your acid gets worse, thereby triggering nausea. So as you can see, this is not a benign condition, although it seems simple. A lot of people miss work because of these symptoms. So it's very surprising if I tell you that a lot of people miss work for simple things like these because they're not feeling so good, where the problem is just passing more stools. So it's very important for us to recognize once your stools are getting backed up and you're not passing stool regularly, start taking some fiber, either soluble fiber or insoluble fiber like metamycil, or soluble fiber like benifiber. But if you take too much of it, it can cause some bloating at times. So start with that one. If you take 2 tablespoons usually at night time, we tell all our patients to take 2 tablespoons at night time. And usually the urge to pass stool is best when you wake up. So you're preparing the gut to be ready by morning. So then you're able to pass those stools and get relieved of the symptoms. And on top, if someone has persistent constipation, then we tell patients to use Miralax or polyethylene glycol. Usually start with 1 or 2 scoops at night time and slowly increase the dose to as much as needed to pass at least 1 to 2 stools per day. And let's say that doesn't work, then our patients go through a test called anorectal manometry, where we're checking if the pelvic floor muscles are working well, where they're pushing out stool like they should. And that anorectal manometry, if it's positive for pelvic floor dysfunction, then you go for something called biofeedback, which ultimately improves your anorectal function and thereby helping you get the stools out properly, then keep using medication all the time. And if these measures are not working, and let's say your pelvic floor is fine, then our patients get other medications, a lot of other good medications nowadays for constipation. But the big picture is that constipation seems like a simple problem, but now, having done this many years in my practice, I keep seeing how many of these peripheral effects of constipation affect patients' lives in general and cause a lot of morbidity and missing work, etc.